The field of medicine is a domain where science and ethics intersect, often presenting practitioners with intricate moral dilemmas. These ethical challenges arise from the fundamental duty of healthcare professionals to prioritize the well-being and autonomy of patients while adhering to the principles of beneficence, non-maleficence, justice, and respect for persons. In this exploration of ethical dilemmas in medicine, we will delve into various scenarios that highlight the complexities faced by healthcare providers and the intricate balance between moral principles. Before we dive in, if you find this content valuable, please hit that like button, subscribe to our channel, and leave a comment below. It truly helps us grow. Now, let's get started. 1. End-of-life decisions. One of the most poignant ethical dilemmas in medicine revolves around end-of-life decisions. Medical advancements have extended life expectancy, but this has also led to an increase in situations where patients face suffering and a diminished quality of life. Decisions regarding the withholding or withdrawing of life-sustaining treatments, such as ventilators or feeding tubes, require careful consideration. Balancing the respect for a patient's autonomy with the duty to prevent unnecessary suffering poses a formidable challenge. In the case of terminally ill patients, should physicians honor the patient's request for medical aid in dying, euthanasia, or assisted suicide? The moral divide on this issue is profound, with arguments for individual autonomy clashing against concerns about the sanctity of life. 2. Resource allocation. The allocation of limited medical resources is another ethically charged issue. Healthcare systems often grapple with rationing resources, especially during crises like the COVID-19 pandemic. Deciding who receives intensive care unit, ICU, beds, ventilators, or scarce medications becomes a matter of life and death. Should age, social status, or other factors influence resource allocation? The principle of justice demands that resources be distributed fairly, but determining what constitutes fairness in these dire circumstances is a complex ethical puzzle. 3. Informed consent. Informed consent is a cornerstone of medical ethics, ensuring that patients have the autonomy to make decisions about their health care. However, this principle can be challenged when patients lack the capacity to make informed decisions, or when they refuse treatments that healthcare providers believe are in their best interest. For instance, when a child's life is at risk, and parents refuse life-saving treatments for religious or cultural reasons, should healthcare providers intervene against the parents' wishes? Striking a balance between respecting parental rights and the best interests of the child poses a significant moral dilemma. 4. Genetic testing and privacy. The intersection of genetic testing and privacy is an ethical landscape fraught with complexity. Genetic testing has undoubtedly revolutionized our understanding of hereditary diseases, empowering individuals with crucial insights into their health risks. Yet, this scientific progress comes with a moral dilemma: how to balance the duty to inform and protect. When genetic information unveils a high risk of severe disease, it sparks a crucial debate. Should healthcare providers have an obligation to notify at-risk family members? On one hand, this could prevent harm and enable early intervention. On the other, it raises profound privacy concerns, potentially infringing on an individual's autonomy and confidentiality. Navigating this ethical tightrope necessitates a nuanced approach. Striking the right balance may involve respecting the autonomy of the individual while encouraging them to share their genetic findings with their family or facilitating anonymous notifications through genetic counselors. Ethical frameworks must evolve alongside genetic science to uphold both individual rights and the broader goal of public health. 5. Organ transplants. The ethical considerations surrounding organ transplantation are multifaceted, reflecting the profound impact of this life-saving procedure. In a world where the demand for organs significantly surpasses the available supply, medical professionals, ethicists, and policymakers are confronted with intricate dilemmas. Determining allocation criteria is at the heart of these ethical quandaries. Should scarce organs be distributed based solely on medical factors such as the likelihood of a successful transplant or the urgency of need? Or should additional factors, such as age, social contribution, or time on the waiting list, be weighed into the equation? These questions raise critical issues of fairness, justice, and the societal value placed on different lives. Moreover, the shadow of organ trafficking and the exploitation of vulnerable donors looms large over the field of transplantation. Ensuring a transparent and ethical organ procurement system while meeting the urgent demand for organs remains a persistent challenge. The ethical framework for organ transplantation must continually adapt, striking a delicate balance between optimizing medical outcomes and upholding principles of fairness and equity in allocating this precious resource. It is a testament to the complexities of medical ethics in the real world, where the stakes are nothing less than life and death. 6. Emerging technologies. Emerging technologies in medicine offer immense promise, but their rapid development also intensifies ethical concerns. Artificial intelligence, AI, and diagnostics, while enhancing accuracy and efficiency, sparks debates about the accountability of healthcare providers when algorithms play a pivotal role in decision-making. As AI systems evolve, ensuring they align with patient-centered care while maintaining human oversight becomes paramount. Gene editing, exemplified by CRISPR-Cas9, holds the power to transform medicine. The ability to modify the human genome presents thrilling possibilities for treating genetic diseases. However, these capabilities also bring forth profound ethical questions. How should society handle genetic enhancement, the creation of designer babies, or unintended consequences in the alteration of our genetic makeup? Striking a balance between harnessing the potential of gene editing and respecting ethical boundaries remains a complex and evolving challenge for both scientists and policymakers. In this era of rapid technological evolution, ethical discussions must adapt, fostering a comprehensive understanding of the implications of emerging medical technologies on patients, society, and the healthcare landscape. 7. Pharmaceutical industry influence. The relationship between the pharmaceutical industry and healthcare providers is fraught with ethical concerns. Drug companies often sponsor research, and physicians may receive gifts or incentives for prescribing certain medications. This raises questions about conflicts of interest and the potential for biased medical decision-making. Ensuring that healthcare providers prioritize patient well-being over financial incentives is an ongoing ethical challenge. Transparency and guidelines for managing conflicts of interest are crucial in maintaining trust within the healthcare system. Ethical dilemmas in medicine are inherent to the practice of healthcare. As medical science advances and society evolves, new ethical challenges will continue to emerge. Navigating this complex terrain requires a commitment to the foundational principles of medical ethics: beneficence, non-maleficence, justice, and respect for persons. Ultimately, the resolution of these ethical dilemmas often involves a careful weighing of competing values and principles. Ethical decision-making in medicine demands thoughtful reflection, open dialogue, and a commitment to the best interests of patients while upholding the moral integrity of the healthcare profession.